Hi, I'm Owen O'Brien. We're living near Bandon on the Bandon-Clonakilty Road. We're farming 93 acres in total. It's a fragmented farm. There's 45 acres on the homeland block here. There's another 23 available for grazing up the road and the shoulders. I'm farming here with my wife, my 3 kids. My parents are still active in the farm. They help out. My grandfather bought this farm originally, so I'm the 3rd generation to follow on. I left Dara College at Clonakilty in 1999. I went to New Zealand for 4 months for work placement. I came back full-time farming. I suppose we had 48 cows at that point in the milk quota years, and we've stepped it up now to kind of 73, 74 cows the last 2 years. We had an issue in 2016, the end of June. We put calves onto aftergrass, and we went up one evening, there was 4 or 5 of them down the field, brought them in, they had high temperature, they were panting and drooling from the nose. So we treated them with antibiotics that time. We thought we were after riding out the storm, and in the autumn again, near housing, got the same thing back again, treated them with antibiotics. So I talked with Kevin Sullivan in Glashall Vets in Bandon. We got results back from the herd health screening, and RSV and PI3 showed up, so we put a vaccination program in place. That year we did them the end of June, I think, because they were already out in grass, and we did them again in the autumn, and in the following year in 2018 we did the calves at 2 weeks and a booster 4 weeks later, and we always do them in houses as well, just because they're mixed with older animals, they're mixed with cows and calf heifers. I can see the benefits of the vaccination. It's a cheap insurance and the long-term production of a cow. So I'm continuing to using Bovipass every year. I think the first year of a Frisian heifer's calves' life is the most important for production going forward as a cow. You don't want any setbacks. I can see the batch of calves that got it initially in 2016. There's a couple of them, they're 3rd calvers now, and they still get maybe a bit of pneumonia, mastitis, lameness, and I can see their comrades that came on the following couple of years are just kind of healthier, fitter animals. They don't get any setbacks if you get bad weather. My motto in general is prevention is better than cure on the farm, so yeah.
My name's Kevin O'Sullivan. I'm a director in Glashall Vets. We're a 10-vet practice covering the areas around Kinsale and Bandon. Of our large animal work, I would say we're covering maybe 80 to 90% of them are dairy farmers. We're seeing a good bit of calf disease at the moment. It's varying between the cripples and rotoscours, but also seeing a bit of pneumonia. And that's to be expected this time of the year. Houses are getting full. There's 2-month-old calves on the ground and 1-week-old calf on the ground. So you're getting a mixture of ages. You're getting an increase in disease pressure in these pens. So look, I suppose we're seeing the consequence of that. For the farmers, they need to kind of remember, keep on hygiene, keep the calves as clean and warm as possible. And look, in certain cases, we end up, and we're definitely recommending a vaccination program to try and to help us with these problems. On this farm, Owen has had an issue through the years with pneumonia in younger calves, but also at the weaning stage. We sat down and decided that a vaccination program that covered the young calves, but it could be extended out towards the end of the year, was suitable. So in this case, we found that Bovilus and specifically Bovipass would be suitable. So Owen tries to go in from kind of 2 weeks of age with the first shot and boosts within 4 to 6 weeks afterwards. And then as the year goes on, before housing, he gives them another booster just so that he has extra pneumonia cover at the housing, especially in this farm because there's shared airspace between the cows and the weanlings. Pneumonia can cause serious impacts on growth rates in heifers, and often the individual sick calf is only the tip of the iceberg and the whole bunch can be affected. Really, I think prevention is better than cure in this case, and especially when you're dealing with replacement heifers, you really want them to be thriving all the way through until they're going to the bull in 18 months' time. So vaccination, I think, is a surefire way of reducing the risk of pneumonia and increases the chances of getting all your heifers to the bull in the following year. We're near the end of the calving season now, and as I say, starting the breeding season. So it's always a good time to talk to your vet and maybe talk to them about vaccination programs, so that we can keep things moving the way we want, get the best out of the calves, make sure that we don't have any disease outbreaks that come and affect us in the year to come.